Okay, so welcome everyone. What we are basically looking at the social and behavioral determinants of health. So in this module, we are supposed to understand the different factors that contribute to the occurrence of diseases or illnesses. So we are supposed to understand the factors that contribute to optimal health. And then we also need to understand some few models that can be used to help us understand these factors quite well. And then the last part will include how we can design interventions, or what kind of interventions can we put in place in order to improve health. Okay, especially relying on the social determinants of health. Okay, so the first thing is that we are going to go down the history lane and look at how um, mankind understood the occurrence of diseases. Okay, why is it that we had people were getting diseases? That is the first thing that we are going to look at. So we start basically. So let us look at what we termed as traditional understanding of health and diseases. And in this, we want to understand how the understanding of uh, disease and health was, and how has it evolved over time. Okay. So the first thing is that not all people will have the same health outcomes. Different people will definitely be having different health outcomes. The meaning of this is that and when we talk about health outcomes, we are looking at aspects to do with the mortality rates, how many people are dying, and then we are also looking at life expectancy. Okay, people live for how many years? That's also something. And then we also look at issues to do with the morbidity, which is the occurrence of diseases in a population. Morbidity, issues to do with the prevalence, how many people are having particular conditions. Okay, so we are saying that these parameters are not always the same, and that's what we mean by health outcomes. That people are not catching diseases at the same time, at the same rate, and people are not dying at the same rate. So that means that when you look at, for example, the country, you see that certain regions are having better health outcomes compared to others. So those that are what that we can say that are having healthier health outcomes or having better health outcomes are the ones where we expect that we are having few mortalities, few people are having diseases, and then also people are living longer. Okay, and the indicators of poor health is when you have increased the mortalities, increased the morbidities, and you also have shorter life expectancy. But of course, we have also all those other indicators. If you want to look at them, you go to what we call measurement of health. How do you measure health? Okay. So previously, the understanding was that the diseases occur in people because of their individual characteristics, what we are terming as innate characteristics, your genes, your genetic makeup, your personality. These are individual characteristics, gender, and issues like that. And then the second thing is about the health threats that come from the environment and also behaviors. So that was the view of how diseases occur in people. That someone can fall sick because of either their personal characteristics or individual characteristics, or because of the environment, or because of what they are engaged in, whether it is smoking, whether it is promiscuity or other things. Okay? So behavioral threats, what one is engaged in, those habits that put them in at a higher risk of getting diseases. Smoking, drinking alcohol, not exercising, that is the sedentary lifestyle, and not, let us say, putting on a seatbelt, not wearing a helmet, and all those things. Those are behavior. Okay, so they lead the person to having disabilities or diseases. Okay, if they are engaged in if they are involved in an accident because they did not have a seatbelt, they are going to get an injury that is going to be worse off. If they don't put on the helmet, it's the same thing. Okay, so that means that it is the person who is supposed to take control of their behaviors such that they can live longer. And then the second thing is that some of the illnesses come from the environment. Okay, if you stay in an environment where you have a lot of toxins, a lot of pollutants, poor sanitation, all this can contribute to diseases. And that means that these are not things that are entirely in the control of an individual, so they are outside the individual control. So therefore, if there was an approach, if we talk about approaches to address these threats, then we are talking about how to influence people's behavior such that they can adopt good behavior. So issues to do with persuading people, educating people, and treating those that have behavioral disorders. That's basically the approach. Then, okay, so the other approach is, of course, dealing with the environmental challenges that whether it is to do with poor sanitation, lack of access to clean water and things like that. It means that here the authorities come in, the public health authorities or local authorities come in to address these challenges. So that was public health by then, dealing with behaviors and then dealing with environmental risks or threats. Okay? But we should not forget that the individual factors also actually play an important role, like we said earlier on. And here we're emphasizing that genetic makeup of an individual influences whether they will get certain illnesses or not. So, for example, you can have people who are having genetic predisposition to getting, let us say, diabetes, and if there's a way the genetic makeup interacts with the environment, and then you can have either the person getting the diabetes or the person not getting the diabetes. Okay, so there is an issue also of combination of risk factors. Actually, these risk factors actually do interact. Okay, and for that case, the emphasis was on basically dealing with the risk factor, and the intervention were directly individual, where the person is either given drug therapy or issues to do with genetic counseling and things like that. And then the other thing previously that was happening is that people were blamed for the illnesses that they had. Okay, so if the person is smoking and gets lung cancer, the blame goes to the person. Okay, so the same thing with even HIV, stroke, AIDS. is still about blaming the people who get illnesses. Okay, so that is still another point under traditional understanding of health and diseases. And we shall see later why that view is not what is being promoted now. So because of the fact that we are looking at risks, risks at individual level, environmental risks, and then also risks that are associated with behaviors, that means that the emphasis of public health was on understanding these risks and how they happen in populations. And remember that when we talk about risk, it doesn't mean that you get the disease. So if someone is smoking, it doesn't mean that the person definitely will have lung cancer. It may take some time. Actually, the lung cancer may not even actually happen. So the person may die of other conditions, but not lung cancer, yet they have been smoking throughout their life. So here the point is that understanding the risk factors is okay, but it is also very important to note that risk factors do not mean certainty. That because you smoke, you're going to get lung cancer, definitely. No, it's not like that. So that is also problematic because how do you convince people to wear seatbelts or put on the helmet if it is not going to eliminate the risk entirely? So that's also a challenge there. Okay, and because most of even the medical interventions that happen in hospital settings, they always carry some risks, and that is why it is very important to seek for informed consent when treating patients, because you don't know what will happen, maybe during the surgery or during a particular procedure. Okay, so understanding risks is very important, but does not always mean that there is the 100% certainty. Okay. The other challenge it poses is that when you understand the risk factors, when you're trying to promote awareness about these risk factors, it becomes problematic to tell people about these risks and make them aware and avoid some of these risks. Why? Because when we say that there is a 60% chance that a person who is circumcised cannot get HIV, that statement comes from population studies, but that may not be the case for an individual person. That when you communicate this to a person, does the person interpret this as a matter of importance to them? Okay, so these risk statistics communicate issues to do with populations, but not individuals, because that reduction may not matter to the individual. Okay, so that's the whole point there. So the other challenge to do with the looking at these risks is an issue to do with the fact that these risks do not explain who is being affected so much by the problem. Okay, so they do not explain systematic population health differences. That's the challenge. Yet, in our opening statement, we said that some populations are having poor health outcomes compared to others. So, as a matter of summary, we are basically saying that our previous understanding of what health is related to the fact that there was a narrowed view of the occurrence of diseases, where the emphasis was on looking at individual risk factors, looking at the environment, and looking at behaviors. Okay, and because of that, a lot of emphasis was on risk factor analysis